About changes to Medicare Advantage plans in 2025 due to the Inflation Reduction Act. Many of you may have heard some rumors or some different things, and I want to make sure that you get, kind of credible information from us first. So on August 16th of 2022, the Inflation Reduction Act was signed into law. Some of the major provisions of the law include changes to Medicare prescription drug plans and Part D coverage within those Medicare Advantage plans. These changes include the following. In 2023, drug companies became required to rebate on their drug prices if they increase faster than inflation. Insulins were reduced to a maximum co-payment of $35, which has helped a lot of people, and then reduced or eliminated costs on adult vaccinations. So, for instance, if you are taking the shingle shot, then that's now free, and other adult vaccinations are free under Part D of Medicare, which includes your Medicare Advantage plans. This year in 2024, they've eliminated the 5% member responsibility when someone reaches the catastrophic coverage stage, meaning you've gone through the donut hole or the coverage gap. Used to be 5%, now that's 0% when someone reaches a certain threshold. And then also, the government has expanded the low-income subsidy. It used to be around 125% for people to be able to qualify for reduced co-payments and cost sharing on their drug portion of their plan. And now you can earn up to 150% of federal poverty level and get those types of benefits. Now, here's the big change that we're here to talk about today. In 2025, there is a $2,000 out-of-pocket cap for Part D to Medicare beneficiaries. So someone reaches $2,000, they'll have no further out-of-pocket for the year for covered prescription drugs. Now, the government is seeking to pay for some of these changes, largely through negotiating the prices of some of the higher cost prescription drugs on the behalf of Medicare beneficiaries. So there's a whole schedule on, how many drugs will be negotiated, and, and there are further details about which ones. So limiting the out-of-pocket to Medicare beneficiaries has been widely viewed as a positive change. However, there may be some adverse consequences to the $2,000 out-of-pocket maximum. In early 2024, insurance companies received guidance from the government that they would be responsible for most of the cost for prescriptions once a Medicare beneficiary reaches their $2,000 out-of-pocket maximum. So you are going to get some information here that most people are fully unaware of. But if you see this chart that was created by Milliman, you will see out to the right that 2023, which largely reflects the current environment, the plan sponsor, which is the insurance company, pays about 30% of the cost of your prescription drugs when it's all said and done. The government, through discounting and reinsurance, is paying around 37%. You, the member, are responsible for about 27%. And then the drug plan manufacturers, or the drug manufacturers, through discounts and other requirements by the government, are paying around 6%. In 2025, that's going to change dramatically. And as you can see, the insurance company is doubling in terms of what their responsibility is with this $2,000 cap, and then also some of the other changes the government is making. Government's responsibility is reduced. You, the member, because you have $2,000 out of pocket max, are paying less. We know that some people have very few prescriptions, so it doesn't look like a benefit, but overall, Medicare beneficiaries are really paying a lot less out of pocket. in co-payments and cost sharing. And the drug plan manufacturers, through additional discounting, are now going to be responsible for 11%. So this is a dramatic shift in responsibility with these with the prescription drug portion of a Medicare Advantage plan, or for that matter, a standalone Part D plan. This other chart, also provided by Milliman, which is an actuarial firm that studies Medicare and other health care policy. This chart further explains the cost shifting, and I want to focus your attention on the middle row, which says IRA, Inflation Reduction Act 2024. Currently, with Part D coverage, the standard model calls for a deductible of $545. Once the deductible has been fulfilled, the member pays their portion, which generally represents approximately 25%. And once they reach $5,030 in total drug spending, then they reach the coverage gap where they are truly responsible for 25%. Some of you have seen this before. But once you get to a certain threshold, you reach what's called the catastrophic coverage stage, where you are responsible for no more of the cost of your drug. So as you could see in the catastrophic stage, 20% is covered by the plan or the insurance company, and 80% is the government, and you don't have any responsibility there. Most of you do not have a deductible if you have a Medicare Advantage plan. Those are mainly on standalone prescription drug plans. But that's how the model is working today. But with the changes coming for 2025, there's an increased deductible, and then you enter the initial coverage stage where you'll have your co-payments. But if you reach $2,000, there is no more coverage gap anymore. So the donut hole, for those of you who've had confusion and headaches around that, that's gone. And once you reach $2,000, then 100% of your cost is being shared between your plan, which, as you can see, is paying 60%, that insurance company, the manufacturer, and the government. So again, a dramatic shift in terms of responsibility and costs. Now, there is no pay increase coming to insurance companies. So there's no plan increase in the amount that the government is paying insurance companies for Medicare Advantage plans. So for those of you who would have heard it from us on how Medicare Advantage plans cost, you might be familiar with the fact that, you know, your zero premium plan, and that insurance company's not doing it for free. They're actually getting paid a monthly amount from the government for each Medicare beneficiary that they have. You would think with that increased responsibility, they might get an allowance increase, but that is not taking place. So in the wake of this $2,000 out-of-pocket maximum in 2025, insurance companies may change Medicare Advantage plans to offset these new costs and remain profitable. Some possible changes include formulary changes for prescription drugs, vacating $0 premium Medicare Advantage plans, increasing the out-of-pocket maximums on Medicare Advantage plans, reducing and or eliminating extra benefits, and some companies will even exit the market, or even, I guess, eliminate certain plans, even if that company itself doesn't fully exit the market. So let's examine this a little more and explore what might happen, and start with formulary changes. So today, Medicare Advantage plans and Medicare prescription drug plans have a lot of tier 1 generic drugs that have no copayment or really low copayments, but a lot of them have zero copayments for tier 1 generics. By increasing the cost of these generic drugs to $1, $2, or even $5, insurance companies can incrementally offset the back-end financial risk associated with high utilizers. So a lot of you don't really have a lot of drug out of pocket, other than, you know, and you're just paying or some generics, and maybe you're not even paying anything. By charging those small amounts for someone who's not going to reach the out-of-pocket max anyway, the insurance companies can recover some of that money that they're going to be responsible for people who reach that 2,000. This probably doesn't come as a surprise to many people, but 81% of Medicare beneficiaries take at least one generic prescription per month, according to Health and Human Services. So other formulary changes. So requiring Medicare Part D enrollees to pay a deductible before receiving co-payment benefits may be happening on some plans. So most plans that do have a deductible only apply the deductible to brand name drugs, but it is very likely that you will see that some plans will say, okay, you have a $555 deductible, and until you meet that deductible, you're going to be paying the allowable charges, the pre-negotiated price for generic prescriptions and preferred and non-preferred brand name drugs until you've met a deductible. So maybe a generic drug is $6.55. You'd normally be paying zero for it, but in 2025, and you might say, yeah, you got to pay $6.55 until you've met your deductible. Some people will never meet their deductible. So your, material benefit is that you're getting the negotiated price for that drug based off of what has been negotiated between your insurance company and that pharmacy. A lot of insurance companies will move certain drugs to higher tiers, requiring Medicare beneficiaries to pay a higher cost up until the point where they might reach the out-of-pocket maximum. So, for instance, someone taking Eliquis might be paying $47 right now, but if they change it to a category where it's 100, another tier, and it's $125 tier, you might be taking the same drug but paying a higher copay. Some drugs will be removed from a plan's formulary altogether. So drugs that are not covered by the plan's formulary are not subject to the insurance company's financial exposure. So this is very important, and we'll address it again later. But if Eliquis, for instance, goes off of your plan, that will be very surprising if you didn't attend a meeting like this or look at your annual notice of change. But that drug will not count towards the $2,000 maximum if it's not on the plan's formulary. And of course, that insurance company has no responsibility for what your out-of-pocket might be. So this is an important point. Really quickly, let's talk about vacating $0 premium plans. In our market today, most Medicare Advantage plans have no premium. In order to offset the exposure to prescription drug costs, some plans may have a premium in 2025. So, for example, a plan today that might have zero premium might go to $25 or even $50. So that's something to pay attention to with your plan and others that you might consider. Increased out-of-pocket maximums on Medicare Advantage plans. Again, in our market today, most Medicare Advantage plans have out-of-pocket maximums somewhere between $3,000 and $6,000. In order to offset the exposure to prescription drug costs, some plans may increase their out-of-pocket maximums next year. So, for example, a plan that currently has a $3,300 out-of-pocket maximum might go to $5,900. So if the insurance company can ratchet up or increase the out-of-pocket exposure for medical, then they might be able to recover some of the costs associated with what's going out the door for prescriptions. And let's talk about another big one: reduced benefits on Medicare Advantage plans. So because of the pricing pressure caused by insurance companies' new responsibility for prescription drugs, it is very likely that those with Medicare Advantage plans will see decreased extra benefits. So as you can see here, this visual representing your dental benefit. Some companies might have a reduced benefit in 2025. Some plans might go from 2,000 down to 1,000. There are all kinds of extra benefits: lens and frame allowances, hearing aid allowances, non-emergency transportation benefits, certainly over-the-counter allowances are pretty common. And even on some plans, albeit in our markets, grocery allowances are more prevalent with the lower income, dual eligible Medicare, Medicaid plans. But, some other markets have grocery benefits. All of these benefits are subject to change depending on how the insurance companies look at it. And those might reduce or go away altogether. So it is important for you to understand which of these benefits are important to you and which plans have them. And we are here to help you with that, by the way. Let's talk about exiting the market. Due to the increased exposure, some companies will leave the Medicare Advantage market altogether. So we have already seen announcements from a prominent local insurance carrier that they are no longer going to be offering Medicare Advantage plans. Some companies basically have run the numbers and said, you know what, this is too much risk, too much exposure. We're not going to do this. I don't think this is a slide, but again, some companies aren't going to just leave the market altogether, but they might retire certain plans, and you will have to actually go seek another plan or be mapped in to a plan that has been agreed upon between the insurance companies and the government. Possible silver lining to those who are going to lose their Medicare Advantage plan due to an insurance company exiting the market is people who have Advantage plans that exit the market will have a guaranteed issue right to move to another Medicare Advantage plan or even buy a Medicare supplement with no underwriting if they decide to return to original Medicare. So again, I don't know if this is a slide coming up. Let's see. Nope, it's not. But some people would like to go to original Medicare and perhaps get a Medicare supplement. However, the underwriting process can be restrictive and prohibitive. But if your Medicare Advantage plan leaves the market, any Medicare supplement plan that you want within certain plan designs, you can get with no underwriting. So that can be important for some people who really want to go to a Medicare supplement. So here are some takeaways. What should you do? So as a result of the news about the Inflation Reduction Act, Insurance Pro's clients should consider the following actions. Consider attending one of our carrier-specific events in early October. During these events, we'll detail exactly how your specific plan will change and how to evaluate what changes might benefit you and what plans might benefit you. So again, if we actually had those plans today, we would start scheduling appointments or having, joint meetings today, but it's not going to be until October 1st when we will be able to share news about these plans with you. But we will have some specific plans. So if you have Aetna, we are going to, have plans, as specific meetings to in person and obviously in this format to say these are the changes coming to Aetna and these are all of the plan designs within their Medicare Advantage family. So consider attending one of those. Complete our Medicare Advantage review form. So by updating us on your current prescriptions, providers, and extra benefits that are most important to you, we can guide you to the right plan for 2025, the one that's most suitable and the ones that meet your needs and priorities. So we feel like we're best positioned to help you. You're going to get a lot of attention, a lot of mailings to go along with your election mail. You're going to get a ton of Medicare mail. and you're going to get invited out to a lot of talks from different insurance companies, and those will be specific to those insurance companies. When you do our form, that's going to give us some updates, and we're going to actually be able to suggest plans across companies. So we don't want to be stodgy and just say, hey, do this form, do that form, but that will be helpful in advance of a meeting with you. Schedule a one-on-one visit. So once we have your completed Medicare Advantage review form, you'll have the opportunity to schedule a visit to address plan options available to you in 2025 that meet your needs. So again, we will not be able to conduct those reviews prior to October because of Medicare's rules, and they won't have the plans available to share until October 1st anyway. So we will be able to actually schedule your visit well before October, but we won't be able to meet until at least October 1st. So subsequent to this meeting, we're going to send an email out, and for anybody who wants to provide updates to their prescriptions and providers and the extra benefits that are important to you, then we'll be able to kind of schedule a meeting. We do think that, by the way, anybody, you don't have to rush to complete a form like that, because maybe things change between now and, let's say, September or October. So just take your time, but as soon as you get that information to us, we'll put you on the schedule. So here are some other key takeaways that you might want to consider doing. Read your annual notice of change to determine what will occur with your prescription drug plan or your Medicare Advantage plan. In your case, a Medicare Advantage plan. So again, in September, insurance companies are required to send you an annual notice of change. And that notice of change is going to tell you if your plan is going to have a premium. It's going to tell you if a drug is coming off of the formulary, or if a drug is changing into a different tier. The problem with it is that the annual notice of change actually has a bunch of information, and you might have to weed through some things that aren't relevant to you, but it will tell you a lot and will be important. This is for the do-it-yourselfer or interested parties who want to do some of the legwork yourself. Go to Medicare.gov on or after October 1st to see all of the prescription drug plans and Medicare Advantage plans for 2025. So one way to really see, okay, which plans cover all of my drugs, which plans, what are the co-payments on all of the different plans, what are the premiums? Medicare.gov actually is going to release all that information on October 1st. So again, we are here for you to help you decipher that information, but anybody who's anxious or wants to, kind of do some research on your own, Medicare.gov is the source to go to, and it shows every credible plan out there. Those with Medicare Advantage plans that are being discontinued should examine whether or not it makes sense to consider moving to original Medicare and adding a Medicare supplement. This is one of the few occasions that allows for a guaranteed issue right to buy a Medicare supplement. Again, some people have run into issues, for instance, where maybe a provider no longer takes any Medicare Advantage plans, or, just maybe your utilization has gotten to where it's really high and you have a lot of different co-payments, et cetera. And you just simply want to simplify things and you're willing to pay a premium. This is not everybody, but some people, it might make sense to look at Medicare supplements. So again, this is a very select group, not everybody, but this is the one time where they can't ask you any health questions if you really wanted to pursue a Medicare supplement. So there's your annual notice of change. I think some of this stuff, yep, those are more things that was repeat information, but these are really important. So remember, Medicare's annual enrollment period is October 15th through December 7th of every year. So plan changes can be made during this time on a guaranteed issue basis. I don't think any of you have forgotten, but nobody can deny you going from one Medicare Advantage plan to another. If you like the benefits of one plan and you want that plan for 2025. If you don't make a plan change during the annual enrollment period, you're essentially locked in to the 2025 version of your current plan in which you are already enrolled. Problem is that plan might not look exactly the same because I think about every plan is going to change based upon the drug exposure. This is something I hear every year. Hey, I like my plan. I think I'm just going to keep it. I think I'm just going to go with them because they've been good. But your plan will change regardless of how much you like the current version of your plan. And I have to go back and reiterate this. We have every year, we have people who call us on December 8th. And then they say, hey, I want to make a change. And then it's like, well, you can't make a change for January 1st because, you know, you've missed the window. But there is another window, which is called the Medicare Advantage Open Enrollment Period. This is January 1st through March the 31st. And this offers you an additional opportunity to make a plan change. So this, in my mind, I always call this, in my mind, the do-over period or the mulligan for those of you who play golf. If you bought a plan that you regret or you look further at the details once you got your information and said, you know what, I don't really like this plan. I didn't know this about it. Or maybe you learn, oh, you know what, this other plan is even better than what I landed on during the annual enrollment period. You have an opportunity during the first quarter of 2025 to make a plan change. So your start date would be the first day of the month following your plan change. So people who make a change in the middle of January will get a new plan for February 1st, you know, and then February 1st, you know, February plan change results in a March effective date. March results in an April effective date. But after March 31st, then you are truly locked in to whatever plan you selected for the rest of 2025. So this has been the information we wanted to present, and I greatly appreciate your attendance, and I hope that this has been useful and constructive. We'd like to have even more detailed information, but that's coming soon. And feel free to put something in the chat if you have a specific question. And of course, as you can see here, you always can contact us directly at 913-944-4465 or email us at medicare@insuranceprosinc.com. And I can tell you that I think about all of you know at this point, I don't work on my own. I have an incredibly capable and professional staff. So Gabby and Jaden are really the main people who work with me on Medicare. So we are going to take this seriously and make sure that, you know, everybody gets addressed as long as it's a priority to them. So let me see. I don't see anything in the chat. I really hope that everybody sees this, but let's see here. One more Q&A. Oh, okay. Chat is disabled. Oh, let's see here. Hold on a second. Give me a second here. Let me see if I can fix that. That's not good. Okay, so I really apologize. I'm not familiar with doing this I mean, we haven't done this that often, but this is open now. So if anybody who's, thankfully about everybody's still on, the chat is open. So if anybody has a question, oh, look at that. Yes, you can listen to the recording later. Absolutely. Thank you, Kathy. Other questions? I'm going to hang on here for a little while. You are welcome. We are going to send you the link to this presentation, although I didn't do the best job. You know, I'm a face-to-face person. Looks like that's the main concern is how you'll get it. We'll get you the recording. And by the way, I'm glad that this is helpful because it's important for us to educate you on why these changes are made. Because a lot of people are going to say, well, gosh, they're charging $25 for this plan. Well, give me a plan that costs zero. And some of the plans that might cost zero might have your higher out of pockets or might take away some extra benefits and everything. We want to make sure and that's why you're going to see the form that you have available. We really want to know what benefits are important to you. And we actually even drill down to make sure that let's just say if someone says, yeah, hearing aids are important to me. We not only want to know if hearing aids are important, if you got hearing aids a month or a year ago or something and you're not due to get them, we want to know if you're going to use that benefit and which ones that you really want to use and value. We want to know who your dentists are. We want to know everything so that we can pinpoint which plans and help save you some time and say which plans are most appropriate for you, because that's not going to be the same for everybody. All right. Excellent. So it looks like we got, the questions answered that came up. Sorry that the chat was not, um, on at first, but yeah, really value you. And I'm looking forward to seeing you all here in the near future. So have a great day. Look forward to talking to you soon.